overhead talk section. Before our guests come in, I'm going to be reading some highlights of today's section we'll be looking at. So I said earlier that we'll be looking at the topic, which is a very important topic to mark the ovarian cancer in the UK year. This is ovarian cancer month of March. And today we'll be looking at some of these highlights, impact of ovarian cancer in women. We'll be looking at how does ovarian cancer affect the ovaries. Also, how does ovarian cancer affect the uterus, and how does ovarian cancer affect the female reproductive system? And lastly, we'll be looking at the effect of risk factors for ovarian cancer in women with and without endometriosis, which our guests will be looking at in a minute. If you're just joining us, you're just welcome. Happy Palm Sunday once again to everyone watching us live. Kindly share with your loved ones, and also, as I mentioned earlier, to mark the ovarian cancer for the month of March here in UK. So every March, Ovarian Cancer Awareness Month is marked in UK, here in the UK, and also the aim is to create awareness about ovarian cancer, especially to women out there. So this awareness is in UK. I know we have the World Ovarian Cancer Month. So it's our chance to put ovarian cancer in the spotlight for women out there, especially in the UK. So over 7,000 women are diagnosed with ovarian cancer every year. So 2/3 of women are diagnosed with ovarian cancer so too late, and also to throw light spotlights about all these highlights we've mentioned earlier. So ovarian cancer is one of the most common cases of cancer related to death in women. So I'll be allowing my guests to come in, and I'll be saying some of the aim why we have to celebrate or have to mark this ovarian cancer for this month of March. How are you doing?
Hello.
Good afternoon.
Good afternoon.
Thank you so much for joining us this afternoon.
It's okay. Good to be here.
Do you want to share your slide?
Yeah, I will do that.
Okay, do that. So why I'm doing this. So ovarian cancer is one of the most common causes of cancer related to death in women. So they should be diagnosed early for better chances of curing it. I know Dr. Izia will be able to tell some of the highlights we've mentioned earlier. So also to avoid the high rates of morbidity and mortality in women as well. So this year, generally, the theme is no woman left behind. That is the theme for this year. This month of ovarian cancer. And the aim of this awareness is to allow us as women to draw attention of women to ovarian cancer, and to raise awareness of the symptoms, as well as to raise awareness of about especially the younger ones in women, and also to create more awareness of the increased risks of the late diagnosis. So our doctor will be looking at that, and we'll be looking at some of this after. And if you have any question or answer you want him to answer after the show, you can drop that in the comment section. So if you're ready, let me know, please.
Yeah, I'm ready. Can you see my screen?
I can see your screen if you want me to hide that now.
Okay, yeah, please. I don't mind.
So before we go straight to the topic or look at what we've got for today, if you could please, doctor, introduce so our audience will know who's talking to them out there, please.
Hi everyone. My name is Daniel. I work in obstetrics and gynecology in Wales, one of the hospitals there. I'm just gonna speak on ovarian cancer today. So it's just gonna be kind of like an overview of ovarian cancer, because it's the ovarian cancer month, so we just have to talk about it. And we know that the term for this year is no woman left behind. So we're trying as much as possible to talk about it, so that people can understand it, get to know about it, and then also know what to do in situations where they find themselves in. So I'll just be going through this pro forma. What is cancer? So we'll talk about what cancer is, what are the ovaries, what is ovarian cancer, what's the prevalence of ovarian cancer, what are the main symptoms of ovarian cancer. We'll talk about the risk factors and what to do if you think you're at risk of ovarian cancer. Also, we'll talk about briefly about screening for ovarian cancer, and then physical problems that people face when they're diagnosed with ovarian cancer, or when they're undergoing treatment for ovarian cancer. And then I'll just briefly share my references. I think before we start talking about ovarian cancer, we have to understand what cancer actually is. Okay, so usually cancer develops when um, process of division happens in an uncontrolled and unusual way, resulting in the cells dividing and multiplying until they form lots of lump or possibly a tumor. So generally, what happens is the cells, usually human cells or general cells, usually go through a life cycle um, from birth till death. But what happens sometimes in cancer is that this cycle becomes uncontrolled and they just grow rapidly and just persisting there, growing rapidly more than expected. And usually, as a default, with some things that control cell division. So that's what usually causes cancer. And when they form a lump, they're either called a tumor or a cancer. So tumors are the ones that would not cause, they don't have risk of going to other places. They just form a lump there. But cancers are the ones that will now develop and start spreading out, and that's the really bad one. So what are the ovaries? For ovaries are two small glands in the reproductive system. So they are kind of like synonymous to the testes that the men have. So the women have two ovaries, and they are in the reproductive system down in the pelvis. And the woman's reproductive system as a whole contains usually from the vagina, the cervix, the uterus, and the tubes, and then two ovaries that stay close to them. What do the ovaries do? The ovaries, the main function of the ovaries in a woman is to produce, store, and release eggs for reproduction, and also to produce female sex hormones. That's the hormones that women produce, estrogen, progesterone, to maintain their activities as women. So, in a nutshell, these are the ovary. This is what we're talking about. So, this is a woman's reproductive system. So, we have two ovaries. We have the tube called the fallopian tube. We have the uterus, which is where a baby forms in and baby grows. And when a woman menstruates, she menstruates from here. This is where the blood comes out from. We have the cervix and we have the vagina. So we just spoke about the whole reproductive system of a woman. So ovarian cancer now is the type of cancer that affects this organ, the ovary. Okay, and the ovary, which is part of one of the main reproductive organs of a woman. As we just said earlier, it develops when abnormal cells grow in or around the ovaries and these tubes also. So when they start growing, they usually will, sometimes most of them will have a firm swelling, or they come as cysts, and just growing rapidly and having a cyst there. Now, ovarian cancer, there are several different types of ovarian cancer. And the type of cancer depends on the type of cell and tissue that the cancer starts in. So a lot of things about the ovaries that will be beyond the scope of our discussion. But in a nutshell, the ovary has three different types of cells, three different types of germlines. We call them germlines. So cancers can happen from any of them: the surface, the middle, or the ones that just produce hormones. So it can happen in any of them. So when we talk about ovarian cancer, it's one of those three. And sometimes ovarian cancers can happen from other cancers that have happened somewhere and spread into the ovaries, causing ovarian cancer. Treatment of ovarian cancer will depend on the type of cancer, the stage of that cancer, and the grade of the cancer which you're diagnosed it. However, the earlier cancer is diagnosed, any type of cancer, especially ovarian cancer, becomes easier to treat. Now, ovarian cancer can be difficult to detect in the early stages. And the reason for this is very simple. It's because its symptoms are quite similar to other less serious illnesses, particularly what we call the irritable bowel syndrome, which is where people just have crampy abdominal pain, opening their bowels, often passing mucus stools, and a few other bloating and all those things. Those are when we go to the presentation of ovarian cancer, you will see that most of the abdominal things that happen in the belly could present like this. But we know that if ovarian cancer is left untreated and undiagnosed, it becomes more serious over time. So that's why we need to talk about it. We need to speak about it. We need to blow the trumpet about ovarian cancer, because it's not easy to pick up, and the ways of picking it up, the signs and symptoms are quite similar to other things. Prevalence, why are we talking about ovarian cancer? Well, what's the reason why we are doing this? Because anyone who has ovaries can get this cancer. And the chances of people above 50 getting the cancer, it's more. Sometimes this cancer could be hereditary. That's, you get it from, if it's happened in your family before, you could be at risk of having this. We know that around 7,500 women in the UK are diagnosed with ovarian cancer each year, and it's the 6th most common cancer in women. So it's quite significant. It's estimated that there are about 4,100 deaths from ovarian cancer in the UK every year. That's a big number, and we're trying to see how we can bring these numbers down and look at what we think about one woman every 2 hours will die from ovarian cancer. That's too much. And the reason is, as we just try to say, common symptoms which are misdiagnosed. We just keep thinking it's just abdominal pain, or it's just bowel symptoms, and so we tend to ignore these things. And then when people are diagnosed, they are quite diagnosed late, and then the prognosis or the possible outcome is a bit it becomes poor. So we keep saying it, that the earlier we diagnose these things, the easier and the better the outcome for people. So what are the common or the main symptoms of ovarian cancer? We just got this picture from one of our NHS trusts. It just clearly says it all. It has 4 main symptoms. One of them is persistent abdominal pain. You just keep feeling abdominal pain. You've eaten, you don't think you have any allergies, or you're not sensitive to anything, but you just keep having pain and pain. It's something that needs to be looked out for. Persistent bloating, and just feeling full all the times, and then opening your bowels. As not your usual pattern, but you just keep feeling bloated. You're not able to eat. You have no appetite. You feel very full when you eat quickly, because something is occupying the space in your belly, so it's quite difficult to eat. And then because of where the ovaries lie, you tend to want to wee, that's past urine more frequently. So we can see feeling constantly bloated, feeling full quickly when you're going to eat. You have a swollen tummy. So some people will think it's pregnancy, some people will think it's fibroids, some people will think that they're just eating and they're quite bloated, not knowing that these things are things that need to be looked out for. And then you have to wee often, or very, very urgent, because it's compressing the bladder. And then sometimes you have pain in your lower belly. These are the main symptoms that we need to look out for. So anybody above 50, 55, 60, having 1 or 2 of these things, it's quite important that you go see your physician. And if you're experiencing these things for more than 12 months in a row, then you need to go have yourself checked. Other things that could happen, besides besides these 4 main ones, are indigestion, back pain, changes in your bowel habits. You're going more often, or you don't even go at all. You're losing weight, unexplained weight loss. It's quite important, because some people, that might be the first sign that something is wrong. Some people who have passed through the menses and stopped bleeding, and then all of a sudden they start bleeding again, and you need to go have this have yourself checked. And then extreme tiredness. Some people have lots of, because of the type of cancer, or because of cancer, some people tend to have lots of fluid in their belly, and you just get so tired easily, just because the cancerous process is happening in the body. They get tired quite quickly. Risk factors. Quite sorry, is a bit tiny, but one of the main risk factors with ovarian cancer is just getting older. Okay, it's more common in older people than younger people, but doesn't mean it wouldn't happen in younger people. For younger people, a few other things could be happening, but it's quite rare. It's quite unlikely that it will happen in younger people, but it's happened, and we tend to see young people now coming up with ovarian cancers, which is quite disheartening. So as you get older, the risk gets bigger, and the risk is greater when in those above between 75 and 79 years old. People who have inherited faulty genes. When I mean by faulty genes, it's genes are the materials that our parents pass to us and we pass to our children. So sometimes there might be something faulty there. So a few things that are coding for preventing cancers or preventing a few things, or if they are faulty and we inherit them, we're at risk of having cancer. We have one of them, it's called the BRCA1, BRCA2, also Lynch syndrome. These are very good examples of things that could cause the examples of faulty genes, which if we inherit, we can put, we'll be at risk of having ovarian cancers. Between 5 and 15 of 100 ovarian cancers are usually inherited, and that's quite a significant amount. Now, for these ones, if we think we have our parents or our grandparents were at risk of having cancers or had cancers, it's always good for us to highlight this to our GPs so that they can be a bit more sensitive to our symptoms when we come. If you had a previous cancer, there's a risk of having another cancer, regardless of what kind of cancer it is. If it's breast cancer, if it's bowel cancer, if it's cancer of the pancreas, if it's throat cancer, any sort of cancer, it just shows that your body, some genes, mismatched genes, some of these genes are not coding well, and then it just puts you at risk. Cervical cancer, endometrial cancer, any type of cancer at all. Using HRT, so we see that people who have gone through menopause, or who had premature menopause, or people who had surgically induced menopause, which is what we do, maybe taking out the ovaries, and then we have to give them replacement therapy. So these are hormones that we give people who have gone through menopause. They are at risk of having ovarian cancers, but if the ovaries are still there. Smoking, we know that smoking puts everybody at risk of cancer, regardless of what you do. As far as you smoke cigarettes, it just causes a whole lot of changes in our cells in the body, and these cells are predisposed to having cancers. Asbestos, I think we know what asbestos is in all the industries that use this, shipyards, big industries who use asbestos for their walls, for cladding, for the roofs. People who work there are usually at risk of having cancer. So we try as much as possible to occupational health, trying to create awareness to try and get asbestos as much as possible away from all these industries. And medical conditions, and this is quite a very important one. People who are diabetic, especially those who are using insulin, who need to use insulin for diabetes. It doesn't mean you will have ovarian cancer, but the risk is just more. And then people with endometriosis, I think endometriosis is kind of like when we have cells that are meant to be in the lining of the womb where women menstruate from. If the cells go out of the womb and stay on the ovary or stay in the belly, they are at risk of having ovarian cancers. But just remember, I keep saying it's just risk. They are all risk factors. And being overweight or obese is also a risk factor because the body produces more hormones than needed and puts you at risk of cancers of the ovary, cancers of the lining of the womb, fractures, and a whole lot of things that could happen. So we were talking about risk factors, things that put people at risk. What are the possible things that can be protective? So we talk about taking the combined pill. Now, what does the combined pill do? It reduces the amount of times the ovary has to ovulate to rupture to get a cyst. Because whenever the ovary ovulates and ruptures, the more it does that, the more risk of having ovarian cancer in a nutshell. So that these pills tend to just keep the ovaries quiet. They don't do anything. They don't go through any processes of the ovarian, some cycles to get the eggs matured. So if it's quiet, it tends to be protective. And people who have children and breastfeeding also, it's still the same in a nutshell. It's still about the same way that the combined pill works through in terms of keeping the ovaries quiet. So anything that keeps the ovaries quiet tends to be a bit protective. So if you have children, you're looking at about 9 months of the ovaries being quiet, and then if you're breastfeeding, you're looking at about 4 to 6 months of the ovaries being quiet. And if you have maybe 4 or 5 children, it means 4 or 5 times you have that cycle of your ovaries being quiet, compared to somebody who's had no children, who's not breastfeeding, and every month the ovaries have to rupture to bring up one, have a small cyst, rupture, and then heal, and then rupture again. So that process puts people at risk. Now, having a hysterectomy or having your tubes tied, it's a bit protective. So we know that a few percentage of ovarian cancers now come from the fallopian tubes. The tubes are very the organs that just stay very close to the ovary. So people who've had their womb taken out, that's hysterectomy, or their tubes tied or the tubes taken out, it's a bit protective. So we tend to see that most times in hospitals now, if they're offering sterilization, they tend to take out the tubes, because first it helps with contraception and then reduces the risk of having ovarian cancer too. Okay, so things that you need to speak to your doctor about. Now, we cannot talk about awareness without talking about what to do if you're at risk. Okay, so that's why we are here talking today about awareness about the risk and what should we do when the risk is there. So if you think for any reason you have the higher chance than average, okay, of developing cancer, or if 2 or more people in your family, okay, on the same side of your family, okay, are diagnosed with ovarian cancer or breast cancer, particularly at a young age, especially less than 50, then you need to talk to your GP about it. Your GP is your general, your family doctor about it. Because there are a few things they can do to minimize the risk. You can have, you can refer you to genetic services where they have a look at your family tree to see if you or if the kind of cancer your family had, it's something that can pass to you, and then they can do some things to reduce the risk of that. Sometimes the GPs will refer to the hospital to ask us to reduce risk-reducing surgeries for people who are at risk of ovarian cancers, usually after 35 to 40 years of age. Provided they've completed their family, we can do a few things in the hospital, which your GP will give you more information about that. So if you're at risk, speak to your GP. Now, is there any type of screening program that we can do for ovarian cancer? For instance, I'm sure you're going to be thinking about how we do cervical screening, which is the program that's very, very effective in reducing cervical cancer. That's cancer of the neck of the womb. But unfortunately, in the UK, not just even the UK, worldwide, there is generally no screening program for ovarian cancer. And the reason for this is very simple. All the tests that we have tried to do, it's not that reliable to pick up ovarian cancer at an early stage. And also, um, different things. For example, we're going to talk about one of the blood tests that could be done. A few other things in the body can produce some of the hormones that we tend to screen for ovarian cancer. So it's generally been accepted that there wouldn't be at the moment. Okay, let me use the word at the moment. There's no screening for that because things are not reliable. But there's ongoing research into the blood test I was just talking about, and it's called the hormone called the CA125, and also scanning for the CA125. It's a hormone that tends to be raised in ovarian cancers. So, for instance, if somebody has an ovarian cyst, having signs of ovarian cancer, okay, you have a palpable mass in the belly, and the GP does a blood test, or we do a blood test in the tertiary hospital, and this hormone level is raised, it increases the high index of suspicion of ovarian cancer. But sometimes, if you have this test done and it's raised, doesn't always mean that it's ovarian cancer, because people who have heart failure will have this enzyme raised. People who have endometriosis can have this enzyme raised. People who have lung conditions, anything that will cause an irritation in the belly could cause this enzyme to be raised. So most times it's not very, very, very specific for ovaries. And also having a scan, a transvaginal scan. This means a scan through the vagina, which looks like the ovaries. That tends to give you very good views of the ovaries. There are features that we look out for in an ovary that has a cancer or is at risk of having a cancer. So these are things that could be done, but doesn't necessarily mean that, for instance, if the CA125 is raised and we do a scan and the scan says there's a big cyst, that doesn't now necessarily mean it's cancer until a few other things are done in the hospital to be able to rule out and do a few more investigations to do that. Okay. What are the things that the physical problems that people will face? I'll spend some more time here just so that we can get to understand what women face and things that they go through when diagnosed with ovarian cancer or when undergoing treatment with ovarian cancer. One of the first things that we take for granted, but it's hair loss, and you can't understand how much this means to a woman, having her hair just falling off because of ovarian cancer. So besides the physical stress and tiredness and pain people have, hair loss is another thing that happens. And this happens usually if it's picked early and we have to use medicines to treat it, kind of what we call chemotherapy. So if we have to use chemotherapy, what chemotherapy does is that it attacks any fast dividing cell in the body. So the hair grows really, really quickly. It's one of the fastest growing cells in the body. So chemotherapy will hit the hair. That's why you see lots of people who are undergoing treatment for cancers generally, and also ovarian cancers. You find that their hair, they're losing their hair because the cancer agent it's affecting the hair, and they tend to have no hair. So it's quite significant, and we need to appreciate this thing. Some people, the hair matters a lot to them, and having to lose their hair because of treatment is quite emotional for some people. Surgery to remove your womb and ovaries. So most times, if it's gotten early, we tend to offer surgery to take out the womb and the ovaries, because if this is where the cancer is coming from, them and we get it early, why don't we take it out to prevent it from spreading out? Now, surgery has its own effect on people. People heal differently. Some people lose their dignity because they think that they've been touched, their body has been touched, or because of the scars of pain and all that stuff. Sometimes we have to do a cut from up to down, from the belly button down, or sometimes we have to go from left to right, cut along the bikini line. Some people don't heal well. Some people have complications of surgery. Some people will have to have their bowels brought out, just called the stoma, just in case, for instance, if the cancer had spread around their bowels. So it's quite emotional also for people after undergoing treatment for ovarian cancer. So we need to try and make sure that we get it early. The earlier it's gotten, the risk associated with surgery and it's very reduced. Hormonal changes. Now, for instance, you know that the ovaries produce hormones, which keeps the woman going in terms of makes her well, keeps her body temperature okay, makes her a woman, produces everything that she needs to keep her thriving. Once the ovaries are taken out, there's a sudden withdrawal of the hormones, so women go into immediate menopause. We know the signs and symptoms of menopause in terms of all the getting tired quickly, hot sweats at night, really, really angry sometimes. And some people have emotional disturbances, brain fog. Some people cannot focus. These are really, really serious things that people can go through. And so I'm trying to shed more light on the impact of this diagnosis of ovarian cancer and its treatment on women. Tiredness is after surgery, during chemotherapy, this stresses the whole body and then causes more tiredness for women. Relationships and sex. Some people lose their dignity because of the surgery or because their hormones are not there. So, for instance, if we take out the ovaries, the woman doesn't have that much sexual drive. Her genital organs start becoming dry, and then sexual intercourse becomes painful. Sometimes she could bleed, and then when these things start happening, it affects her, it affects her partner, and then gradually problems start coming up, and the relationship starts drifting apart. So more things that affect the woman when being treated for ovarian cancer, especially if we take out the ovaries early enough. Yeah, so I think I just hope I've been able to go through an overview about ovarian cancer, what it is, why we need to talk about it, especially because of most of these problems. And then I forgot to put even death also. Death is a final, anything cancer, if not treated, it will result to the ultimate death. So we need to try and make sure that we talk about it. It's very difficult to diagnose. It's very difficult for we as clinicians also to pick up the symptoms. So if you think anything changes in your body, please get to see your GP or get to see your doctors immediately so that we can talk about it and we can run some tests to prevent it from getting that bad. Okay, thank you.
Thank you so much, Dr. Daniel. At
Yes.
least you've gone through these highlights we have here. I'm going to be asking for question, and for audience out there, if you have any question, do you mind me removing this from the screen? Is that okay?
Yeah, you can.
So for those that viewers out there, if you have any question, you can drop that on the comment section so we can look at that before he leaves. So you've looked at those highlights with on this topic. We've discussed about ovarian cancer, how it can affect women in details. But there's one particular thing I just want to ask before I go on with other questions. Like, for instance, a woman that has a womb being removed, is it possible for that woman to have ovarian cancer?
Yeah, it's still possible.
Is that possible?
It is possible, and the reason it's possible because the womb. There was a diagram I showed earlier trying to I don't know if I can. Do you think you still have my slides there?
Do you want me to add it back?
Yes. So how can I go back to hold on. Can you see my screen now?
Yeah, we can see.
Now, yes, it's possible. The simple answer is yes, it's possible, and I'll explain why. So this is the ovary. This white thing here is the ovary. Yeah. Okay, and then when we talk about the womb is this organ here from this thing here, the fallopian tube, and it stops here. So if we take out the womb, that's a hysterectomy. That's what you just asked. Or taking out the womb is we're taking out
Yeah.
this, okay, and we're leaving the ovary. Oh, the right done. And we're leaving the ovary. So as far as the ovary is still there, it's possible to have ovarian cancer. Okay.
Thank you so much.
Yeah.
If you have any question for audience watching out there, you can please drop it here in the comment section so we can look at that before doctor took his leave. Another
Yeah.
thing I'm going to be asking you, I think is part of the highlights we've mentioned, like the effect of risk factors for ovarian cancer in women with and without endometriosis. I don't know if you can share more light on that, please.
Um, and endometriosis, it's kind of like it's a different condition, but it puts some people who have it at risk of having ovarian cancer. So it just increases the risk of ovarian cancer, particularly if we have this endometriosis on the ovaries. Now, what endometriosis is, if you see my screen where we have the uterus, I don't know if you can you see
Yeah.
where we have the uterus. So the lining of these cells here, if
Yeah.
they now happen on the ovaries, okay, it means every month that the woman is meant to menstruate and blood comes out, it means she keeps menstruating in little spots on the ovaries and everything. So anything that keeps the ovaries active, okay, the more active the ovary is, the more the risk of having ovarian cancer. So it is a risk factor, but doesn't mean they will have ovarian cancer because there's one type of ovarian cancer also, one of the types that's called endometrioid. And that type of cancer is usually endometriosis related cancer.
Yeah. At the moment, there's no question here, but before you take your leave, I would like you to please advise a woman out there as we mark our, this ovarian cancer month before we end this month of March, especially for ladies out there. We've discussed about the symptoms and some of the risk factors. If you could please advise a woman out there.
Yeah, ovarian cancer is difficult to diagnose. It's a nightmare for all of us in the hospital, in the primary healthcare. It's a nightmare. So we need women to speak out. We need women to report anything that is just out of the ordinary. Okay, don't sit there and think that because you've eaten and your belly is bloated and you've been bloated for 4 6 months and then your belly keeps getting a bit bigger or you're losing weight and you just think it's normal, maybe because you're being tired. It's not normal. Always go report to your doctor. Anything that's different. If you've gone through menopause and you're bleeding, again, it's a red flag. You must go and report it to your doctor. Or you're losing weight unduly, not like you're doing any exercise or you're dieting or you're going through a difficult time. Nothing. You're just all of a sudden you're losing weight despite everything being normal. And you have to go and speak out because people are dying from this. And because it's difficult to pick up, when we pick it up, it's a bit late. And then that's why you hear that people who are had ovarian cancer, before you know, you hear that in 5 10 years, they're gone because it was picked quite late. And it's not anybody's fault, in all honesty, it's not anybody's fault because it's difficult to pick up. Difficult for the patients, difficult for we, the physicians, difficult for the GPs. So I wouldn't say anybody's to blame. It's just that's why we're talking about it so that people can keep knowing and understand that yes, that this thing is actually something that could happen and we need to talk about it. So please speak up always.
Thank you so much. Before you take your leave, lastly, let me ask this. I know there are lots of organizations, apart from the NHS, like
Yes.
we do have breast cancer and others organization that supports women in terms of breast cancer awareness and stuff like that. In terms of ovarian cancer, is there any organization you could recommend or you could tell to our audience that they
Uh,
can visit apart from NHS?
there's the Cancer Research UK. Cancer Research UK. It's one of my references.
Okay.
Cancer Research UK.org, I think. And there's also ovarian cancer. Do you still have my slides there?
Okay, you want me to have that back?
If you can, so that I can just show you if you so number three there is Cancer Research UK. Number one is Ovarian Cancer UK. So ovarian cancer UK is specifically for ovarian cancer, but Cancer Research UK is for any sort of cancer you're looking for in the UK. You'll find all of them: the ovary, breasts, colon, anything. You'll find them there. But ovarian cancer UK is very, very important. I think they are very, very good at providing. They explain things very, very in simple terms that anybody could understand. Okay. Um, there are places that we could get help from.
Thank you
Okay.
so much, Dr. Daniel. It's good to have you again on a section, and thank you for your time. I do appreciate that. God bless you, and I hope to see you again.
Definitely. Always, always happy to always come in here.
Thank you very much.
Okay. Yes, thank you.
You're welcome. Bye. So that is it from our guest speaker on our topic of our hair talk section, which is the effect of ovarian cancer in women. I mentioned this earlier that this is an awareness that we mark here in the UK. I think there's another one coming up later in the future, which is the World Ovarian Cancer Awareness. And I've mentioned the aims. We've looked at this guest speaker was able to look at the highlights we mentioned, the impact of ovarian cancer in women, and it can affect the risk factors and what have you. And I'm going to say a few things during my home course of research about this section. I will look at the impacts just in a nutshell, the impact of ovarian cancer. I think he has mentioned a lot of information that we need to know about ovarian cancer, but before we leave again, let me just mention this few so I hear it for those people that are still watching and those that will be watching after. So the study found that women with ovarian cancer were at much greater risk, which he mentioned that women are at much greater risk for mental illness in the first 2 years of the ovarian cancer diagnosis. And he has mentioned some of the symptoms and some of the things we could see in terms of after diagnosis. So, according to the research, it said women with ovarian cancer that have been diagnosed with ovarian cancer are likely to have 3 times increase in depression. So it could affect mental health as well. It could affect the way of life. Just doctor have mentioned that people with ovarian cancer, when they are diagnosed, they have a lot of issues and problems related to tiredness, hair loss, and what have you. So ovarian cancer happens when the DNA in the cell stop working correctly. I think doctor mentioned that earlier. They're creating abnormal cells that grow in uncontrollable. So these cells can form tumors in the body, and if it is left untreated, it can spread in the body, it can spread in other parts of the body. So as a woman, we need to be conversant with all these symptoms we've mentioned in terms of ovarian cancer. Prevention is better than cure. So another thing I would like to say is, how does ovarian cancer affect the ovaries? I think doctor have laid more emphasis on that as well. So ovarian cancer affect the ovaries. It affects women ovaries, and over the age of 50, according to research, over the age of 50, it can affect anyone who has ovaries. And ovarian cancer starts in the ovary, which is the small organ in female reproductive system that we all know as the ovary. So ovarian cancer is sometimes difficult to detect, according to what he said earlier. It's so difficult to detect, and as well, because of the symptoms, it develop, until larger stages. So we need to be conversant with our body with all the symptoms that have been mentioned. If you're a lady out there or a woman out there, all these things we need to check on, just the way we check our breast in terms of breast cancer awareness when we discuss awareness. So ovarian cancer is sometimes difficult to detect, as I mentioned, and also the cell may form a tumor in the body, which we have mentioned, and it can break off from being a tumor and spreading as part of the body. And how does ovarian cancer affect female reproductive system? Doctor has also mentioned that. I think he elaborates more on that as well. So this tumor might press on the ovaries and the uterus. Just if you can still remember the image he showed us. So the tumor can press on the ovaries and the uterus, which is the womb, causing them not to work properly. And also it can affect other parts of the body and in terms of the reproductive system of the female reproductive system, preventing the eggs from being released and fertilized or implanted. And also lastly, this can be more of harm to women, especially when we talk about the pressing of the reproductive system, pressing down the egg, so it can do more harm than good. So the reproductive organs and glands that control the fertility, it can affect it as well. And lastly, the effects of risk factors, which I asked on the last question, or which is one of the highlights, effects of risk factors for ovarian cancer in women with and without endometriosis. So someone that has the first degree family history of ovarian cancer is associated with this increased risk, regardless of this endometriosis status. I think doctor has mentioned and explained that area. So, however, the increased risks appear to be a greater risk for women. So, if you are out there watching us, this is ovarian cancer month. Let's be more aware. Let's be more, be one, and let's look out for these symptoms. And if you need any help or more information, you could get help from the Cancer Research UK, and of course Ovarian Cancer UK as well for more information, for more help. And apart from that, you could visit your GP if you think like everything we've mentioned in terms of the risk factors and in terms of symptoms that we've mentioned are related to your health issues. You can visit your GP as well. Prevention is better than cure. The earlier, the better. The earlier it is detected, the earlier it is treated. So that is it from us today on this section of our health talk section. Thanks so much for joining me. Thank you so much for believing in this vision. For those that join us in the course of today's section, thank you. I do appreciate. And at this point, I just want to acknowledge those people that are here for your contribution. And Justina Faturoti, thank you for joining us today. Olubumi Alice, thank you so much for joining. And those that are behind the screen, thank you so much for joining as well. Thank you so much for believing on us, for joining us. Kindly share with your loved ones as well. Don't let this benefit, let other people benefit from this. Don't be only the one that will benefit from today's topic. Thank you, Molara Oduola. Thank you so much for joining us. And also next week, which is the last Sunday of the month of March, I don't think we'll be here, which is our what's it called? Easter Sunday. So pardon me for those that are celebrating the month of March. If God Taris is coming, if Christ Taris is coming, I'll put something up on the platform to celebrate you guys. But unfortunately, we'll not be here live next Sunday because it's Easter Sunday. We need to have that break. We need to enjoy ourselves. And by special grace of God, probably the first week or second week in April, I will be back fully again. We'll be looking at another topic. I'm looking at one of these immigration topics that we could look at. I know because we're going into new season in April here in UK. So there are a lot of new laws that will be out in terms of immigration. So we're looking at a topic, I guess that we'll be looking at that for us probably when we're back in April. So stay tuned, share with your loved ones. If you are just joining, support our page, which is our Divine Mercy Vision UK. If you have not supported us in terms of on liking and also following us on our YouTube, on our Facebook channel. That is the only support we can get from you. We are not asking for money. So thank you again for those that joined us today. God bless you. You all know that this show is between the hours of 4 and 5 p.m. And I look forward to seeing you in 2 weeks' time by the special grace of God, Christ Harris. And before I go, I'm going to say a word of prayer as a custom and also a short music to end the show. So Heavenly Father, we thank you for today. Thank you for your son that you have used to speak to us on today's episode of our health talk section. Father, we glorify your holy name. We bless you. Father, even as we go into the new week, you bless each and every one of us, oh Lord. Thank you for this word that have come, Father. We pray, Lord, as men that have an issue related to this topic, ovarian cancer, we pray that you, Lord, will visit them, even at the point of their needs, in the name of God, the Father, the Son, and the Holy Spirit. Amen. And we pray as we go into the new week, you bless us, you bless our family, you bless our children, you bless all that pertain to us, in the name of Jesus. And I will say happy Palm Sunday to everyone watching us again. Thank you so much for believing in this vision, for joining us on this our Air Talk section. I want to use this medium to say thank you to our guest speaker. I know